Hospital Transitioning Care, HTIC, Discharge Adherence Service. Our goal is to help reduce preventable hospital readmissions. Of every 5 Medicare patients who are hospitalized, 1 will be readmitted to the hospital within 30 days. Hospital readmissions account for $17.4 billion of the current annual Medicare budget of $102.6 billion. That means that almost 20% of the annual Medicare budget goes to hospital readmissions. There are 4 main root causes for this costly phenomenon and severe problem. First, the lack of communication between the hospital and the PCP. Second, low patient-to-PCP follow-up. Third, medication compliance issues. And fourth, ineffective coordination of patient care. We believe HTIC has the potential to address these blockades and tame the readmission beast using innovative technology and a multi-channel approach to connect the patient, the hospital, the PCP, and caregivers. Here's how it works. A member of the hospital discharge team sits with the patient on the day they leave the hospital and reviews the discharge instructions with the patient. The patient then gets a call from their transition liaison, who will be connecting with them over the next 30 days to help the patient adhere to the discharge instructions. So the patient is on the right track from day one, right in the hospital. The big change here is that now, instead of being sent out into the world on their own, the patient is supported by a technology-enabled team. The discharge instructions are transferred electronically to the HTIC service database. From here, they're shared across the extended care team, including family caregivers, the PCP, and the transition team. The HTIC service coordinates post-discharge patient care via technology, including email reminders, access to a personalized web page, and a dedicated transition liaison. A core component of the HTIC service is the daily health check. The health check is a series of 5 questions designed to help identify any problems early to help keep the patient out of the hospital. There are 3 ways for a patient to complete their daily health check: by phone, by interactive voice response, or on the website. In all cases, data is transferred directly into the database. HTIC allows patients, caregivers, and the PCPs to track the patient's progress and receive up-to-date messages that may indicate potential warning signs. The transition liaison then contacts the patient to confirm responses and refers the patient to a nurse or doctor for follow-up. An alert is also sent to the patient, urging him or her to contact the 24-hour nurse line, or if the matter is less urgent, to make an appointment with the PCP as soon as possible. Our goal is for enrollment in the HTIC service to demonstrate reductions in 30-day preventable readmission rates. This will demonstrate the seamless integration of the PCP, the patient, and the caregiver by the transition team. Almost 20% of the annual Medicare budget goes to hospital readmissions. But with HTIC, hospitals can achieve the Partnership for Patients goal of reducing readmissions by 20% by the year 2013. Hospital Transitioning Care, HTIC, Discharge Adherence Service.